Board.
The Students' Representative Council at Wits University says it's worried that more students there may take their own lives after 3 students committed suicide at the institution in just the last 3 weeks. It shows many things. It shows the impact of COVID-19, shows the stresses students are under. It also shows what's happening in higher education systems, perhaps at the moment. Well, we're joined now by the CEO of Higher Health, Professor Ahluwalia, and the President of the Wits SRC, Mpendulo Mfeka. Mpendulo, if I may just start with you. Good evening. Every time someone takes their own life, it's a tragedy all of its own with its own ingredients, and a life has been lost. But what could be happening at Wits University to have 3 people losing their lives in this way in just 3 weeks?
Yeah, so first and foremost, I'd like to greet the viewers and the listeners at home. But I think if we misdiagnose what the problem is, right, as it regards these suicides, we are likely to mistreat it, right? And to be blunt, more than anything, I must mention that the university systems or the systems put in place that are intended to address mental health and issues of this nature on campus are inadequate, right? And when I say they are inadequate, we have a sham department called CCTU. When students go there, they wait for weeks and weeks and weeks and weeks. Suicidal students, that is. And not only that, we must also understand that, look, we are in a pandemic and a lot of pressure is mounting on students, right? And the mistake that is often made is to say that students have academic pressure, and it's not limited to that. I mean, the past 3 students who've committed suicide at Wits, one was an LLB final year student who was highly performing and performing very well and was fully funded. The other one was a dramatic arts student who was also in a final year. And then the other one was a master's in pharmacy student. So these are students who would not necessarily be put or be perceived as students who are struggling academically. So the misdiagnosis that might happen here is likely to come up with a mistreatment. So, and obviously we must not excuse the university and the government in their role in this, right? Because, I mean, systems that should be in place should readily be there to serve and to prevent things of this nature. Every night when a student, like for example at Wits University, I think it's one of the very few institutions in the country that doesn't have an ambulance system when a student is facing a crisis after 5 o'clock in the day, right? So things like that, we only want to respond to them when they've happened. In fact, not even respond, we want to shoot them under the carpet once they've happened.
Professor Ahluwalia, I mean, obviously this is a very complex area, and I want to reiterate that every single incident of suicide is its own tragedy. But Mpendulo is making serious and important points about the support that students need.
No, absolutely. Thanks, Stephen. And Mpendulo is absolutely right. Mental health has been one of the biggest pandemic before even COVID. Our studies and researchers have clearly indicated that 1 in 4 students live with severe depression or moderate anxiety, moderate depressions. Suicide has always been the 2nd biggest cause of death in young people, and specifically in higher education. And now with the recent impact of COVID-19 that we just recently launched our survey just about a couple of weeks back, we have really declared that 65% of our students are severely under psychosocial distress, or moderate to severe psychosocial distress. And I think the 3 deaths in 3 weeks in Wits is a brutal reminder of the impact of mental health, in fact, to every young person. And there are many reasons to it. And when we look into the reality of things, you know, the same generation of young people has academic stress, this uncertainty of the career, their own parents, their own relatives are dying. There are parents and relatives who are losing jobs. There's financial distress. There's a challenge with food. There's a challenge with connectivity. And if Wits, a university which is historically advantaged and has systems, and the reminder goes into, for us, as realities of our rural universities, our TVET colleges, our community education training colleges, which are in deep rural and semi-urban areas who even do not have greater access to any of these services. So I'll go on to discuss about what we need to do. But at this moment, I really emphasize that this is huge, and I'm acknowledging this. And this is absolutely what COVID has brought, has just exacerbated, if not doubled, quadrupled the numbers of impact of our mental health stresses among young people.
Mpendulo, I mean, you made the point that the people involved here weren't first or second year students, and we have often seen in the past they can be the most vulnerable. Younger people sometimes are, not always, of course. But this shows you that, I mean, perhaps the pandemic is playing a massive role here. Do you think that the pandemic is a big factor, or is there something else as well that's going on?
So I think it would be unfair to disregard the pandemic as a huge factor in this, right? I mean, joblessness currently is above 70%, right? So there's so much uncertainty in young professionals or in young academics who are intending to go into the job market. Young people are at school, they have the necessary qualifications, but they don't know what those qualifications or how those qualifications will serve them post university, right? And it's not only that, but if you remember when the year started, we would have witnessed protests across the country. And at a mental health level, that was not addressed post the protests, right? And this happened in 2016. We managed to sweep it under the carpet when the Fees Must Fall happened. It's happening now again and it's beginning to alarm us, right? I think people need to start taking their lives for us to start responding to this. And that's the wrong approach, right? So we witnessed the passing of Mthokozi Sintumba. Students witnessed that happening, and they were expected to go back to class as though nothing happened. Even worse, the students were expected to perform online without devices at this point in time. It's even arrogant. There's a head of school who are still going to visit at Wits University as the SRC, the accounting head of school. She sent out an email to students saying that she doesn't care about your connectivity or about your network or your access to electricity. You must write the exam in the time prescribed, in the manner prescribed. And we know the crisis in our country. Now, there's people who are in remote rural areas who are expected to perform the same way as someone who's in Sentin in this COVID pandemic. So it's likely that that person is readily thinking they are set up for failure. And not only are they just set up for failure, but they are not even going to succeed in attempting to write those particular exams, right? So the government needs to play its role, and it needs to play an active role in ensuring that this happens. I mean, at med school, it's even worse. Most of the health sciences, oral health science faculty students have lost their academic year because Charlotte Maxeke is still not operational at this point in time. And the right questions need to start being asked. Why is Charlotte Maxeke not open? Because not only is this a disadvantage to students, but it's also a disadvantage to young people in general who want to access Charlotte Maxeke, right? So we can't have an unemployment rate of above 70% in a pandemic and expect young people not to kill themselves, right? So we need to start asking the right questions to the right people.
Professor Ahluwalia, there's a lot that happens, a lot that Mpendulo Mfeka has made several points there. The one thing that I just want to say is that while I completely accept that all of us are going through the most traumatic mental health time during the pandemic, students are in institutions that are supposed to have the resources to help them. And I realize the University of Fort Hare isn't going to have the resources of Wits University. But I would think that Wits University would have the ability to help students in this way. It should do that.
They are failing dismally. And when I say they are failing,
I'm sorry, Mpendulo. My question was, Mpendulo. My question was to Professor Ahluwalia. Professor, are you with us?
Yes, I am. I fully hear the anger and the frustration of Mpendulo. I'm absolutely with him in this regard. I think, we have the reality of the fact is we've got a pandemic in front of us, which is our biggest threat at this moment in the country. Second important thing is I'm not going to be a spokesperson on behalf of the government at this moment, but to let everybody know that in government, from government perspective, this is not going to be one just with government. I mean, in reality, government, parents, student formulations, private sector, civil society, all need to play our role together. And I'm focusing on the health and wellness and development perspective of the young people.
Sure. Professor Ahluwalia, I'm sorry, I mean, maybe I wasn't exactly clear in my question. What I'm trying to get to is that surely Wits University has a duty to look after young people because young people are there, they're in the institution. It seems the university, I mean, they're not here to represent themselves, but it could be that they might be failing in this.
I think, I mean, I'm not going to, again, as I said, it's unfair for me to speak without not knowing what the WITS has done and what WITS has not done. But the reality is we have 3 lives that have lost, and every life matters at this moment, which is absolutely the brutal reality. We need to continuously push towards saving further lives. As I indicated, the WITS University is the most resourceful university compared to many others. And if this happens at WITS, the reality hits us is what happens at our rural universities and TVET colleges around, CET colleges. Again, the emphasis is we had 15,000 crises in the last 6 months since we opened our toll-free helpline. And we're trying to reach through your medium into every medium these 24-hour helplines and crisis lines. I know these just sounds to be a telephone number eventually, but we have 15,000 crises that came. We feel that we did try to avert them. It's not just one call at 3 o'clock in the morning when people do commit suicides and try to talk about their mental status or psychosocial distress at that moment with a counselor or a psychologist or a social worker. But then it takes about those 9 different phone calls eventually after that, linking to the psychologists and social workers. Mental health is very tabooed and stigmatized. Very difficult it takes for people to take that call and call when the crisis really hits. It's that very difficult situation. And yes, we have not been able to sift these 3, but through your medium, again, want to market this number of 0800-363636 again and again, so that many more lives, not in WITS, in Walter Sisulu, in Wenda, in CET College, TVET College, people who are listening to you know that such things do exist. And there is no respite to the fact that the reality is, and if our data shows 65%, these 3 lives were among the 65% that has taken a very difficult decision. Whether it's a systemic failure, whether it's a pandemic failure, whether it's a failure of a university not doing it, the reality is this pandemic is really touching now. And as we continue moving forward and this pandemic stays with us, these realities will go more brutal and more deeper, and we need to be more harder to ourselves, more prepared and more social compact with the youth, more social compact with the system around in order to fight this. This is going to become more difficult.
Professor Ahluwalia, the CEO of Higher Health, thank you. Mpendulo Mfeka, the President at the Students' Representative Council at WITS University, I do appreciate the time. Thank you. If I may just say as a personal note, it is worth keeping the number of SADC, the South African Depression and Anxiety Group's number, in your phone. You can Google it, you will find it. It's 0800 567 567. 0800 567 567.
Such an important conversation, Stephen, because what we know is that mental health and mental wellness could well be the pandemic that will stay with us long after we have survived COVID, at least for those who will be able to get through this current phase. Well, South Africa's annual consumer price